former Democratic Congressman Dennis Kucinich. The gist of that is that it's crazy, Dennis, right? I mean, I think to say that people are going to die or there's going to be bedlam, or to follow up on the heels of remarks by Nancy Pelosi and Chuck Schumer, we're going to have a period of violence. I mean, come on, right?
Neil, there are people out there that if they don't have insurance, they're not going to go to the doctor, they're not going to get care, and when you don't get care and you're sick, death is one of the possibilities.
So when this was being cooked up, just to be clear, were people dying left and right, and then with a wave of the Obamacare wand, they were suddenly saved?
We have a healthcare system which is really about sickness, not wellness. It's market-based, which means that the insurance companies win no matter what. Neil, the American people are not being served here by the present system. And this bill, that's whatever bill comes up for the Senate, it's going to have people not being able to afford insurance, people thrown off of insurance.
They can't afford it now, right?
Well, you know what? You are exactly right. People can't afford it now. Now, why is that? Because insurance companies have to make money out of this system, and if they can't, they raise the rates. Everyone knows that. So I'm very concerned that we've got this great debate going on, and the American people are left way out of the debate. This is all about trying to meet the needs of the insurance companies, not meet the needs of the American people.
Now, you know, you and I agree on that. I always wonder, I tell my staff this, that every time I see insurance companies are happy with a package they've cooked up, I'm not happy. Maybe because of all of my ailments, they're very slow at paying me back. But having said that, I wonder how it got to be this way, where the success of a plan depends on if these insurance companies like it, because they're in it to make money. I understand that. But it's gotten to the point where they will back out of exchanges, back out of coverage if it gets pricey. So you have to do things to entice keeping them in. So Senator Cruz comes along and offers a variety of plans that they can offer, as long as they have that one-size-fits-all coverage that the President Obama favored, with one that maybe young people have a bare-bones package. And yet that was ripped by the insurance companies as well. No. So where is this going?
Well, you mentioned young people. If a young person does have health problems and they have only a minimal coverage, they'll be in hock for the rest of their life trying to pay off their bills, as they are with their student loans. So we have to look at what works for all the people in America. And what works for everyone is what works for every other industrialized democracy, and that is that you have a single-payer system, everyone's covered, nobody goes broke, no bankruptcies, people don't die because they can't get health care. We have to start looking at the bigger picture here, and frankly, there aren't many people in either party who are doing it right now. It's all about, you know, how can you work it so the insurance companies will agree? Well, I'm sorry, that's not a way to take care of people in this country.
What's going to happen to this? I have a feeling that when these things are negotiated, this is getting paler and paler, this alternative plan, this, you know, light version, whatever they want to call it, where it won't be markedly different than the plan we have now. I guess it's a jumping off point for them to work, you know, something else out with the House. But I don't see it being a repeal of Obamacare, which brings me back to the notion, why was that such a sticking point? Republicans had vowed that they were going to repeal it, which they haven't. Democrats said they wouldn't get on board if repeal was in there, no need to worry now. So ironically, they could have gotten a lot more Democratic votes for something that really marginally changes the program we have now.
Well, the program we have now does have its limitations. It's still, premiums have gone up significantly in the last couple of years. But if the Republicans go forward and they repeal Obamacare without any replacement whatsoever, there's going to be tens of millions of people who will be adversely affected. And in the end, the concerns of the American people have to be of paramount interest here. And frankly, in all this health care debate, because of the tremendous economic influence of the insurance companies, I don't think the concerns of the American people and their health and their financial conditions are part of the debate. And I hope that it gets back to that. And I hope that if the Senate does act, that they will come up with something that will meet the needs of all the American people. But frankly, with this market-based approach, I think there's an inherent fallacy in trying to believe that somehow we can let the market determine exactly how much people pay, if they're going to be covered or not. That's a prescription for a country that doesn't take care of its people.
All right. Congressman, very good seeing you again. Thank you very much.
Thank you.